Hi everyone, I'm Sri Teja, and today I'm honored to be with Dr. Padmashri Srinivasa. Thank you so much for coming to this interview, Dr. Shri.
Absolutely my pleasure, Teja, and I'm so excited about the work you're doing.
Thank you so
Thanks
much.
for having me over.
Thank you so much. So today we'll be learning about what she is and who she is as a doctor. So Dr. Shri, can you tell me like a little bit about what you do as a doctor?
I wear many hats, and I am a hospitalist, and I also work as a ED physician, and I am the medical director of a regenerative wellness clinic. I'm also board certified in bariatric medicine and lifestyle medicine, and somewhere these are all connected. So I wear many hats.
Wow. So we'll be going into a little bit about regenerative medicine later, but Dr. Shri, can you tell us like what got into you to medicine and like why did you choose like all these professions that you're doing?
That's a very interesting question. When I was born, apparently my mom saw I had long fingers apparently, and so my mom was like, "Oh, you're going to be a surgeon," and so there was this subconscious brainwashing by my mother. She was like, "Oh, you're going to be a doctor. You're going to be a doctor." So I just grew up wanting to be a doctor. I didn't focus on any other career choice, and and so I got into medicine, which is I went to medical school in India, and it's fiercely competitive to get into medical schools in India. I had to be at the top of my class to do so, and I got in. And I came to the United States in like about 28 years ago, and then pursued my residency in Atlanta, Georgia. And why did I choose to do so many things? Is that your next question? Well, my initial training is in medicine, and somewhere I was the medical director of a hospitalist program. I have leadership experience for more than 8 years, and somewhere along the way, I had moral injury and burnout because non-physicians were telling me what to do, when to do, how to do things, and I wasn't very happy with that. And at the same time, my kids left home, and I was an empty nester too, and so I just wanted to pursue my other interests. I am an artist. I would like to call myself that. At least I'm very passionate about art. So I started looking for something that would hone my creative aspects in medicine. I didn't want to leave medicine and go away because I had too much invested in it. And so I looked at cosmetic dermatology or aesthetic medicine, and I treat my patients' faces like a palette and like a canvas, and so I can create so much art and help with anti-aging and help them regain confidence, which is a huge therapy, boosting confidence. I've, when I see them regain their confidence, it's such an amazing gift for me. And so I find it very fulfilling. So.
Wow, that's so great. You're so inspiring. You do so many different things. But let's get a little bit into regenerative medicine. Now, I don't know what that is myself. So do you mind explaining that and like what exactly inspired you to choose such a field?
Yeah, so I told you that I forayed into aesthetic medicine or cosmetic dermatology, and regenerative medicine is a very important component of aesthetic derm, and that's how I came into contact with regenerative medicine. And regenerative medicine is basically regenerating cells, okay, and helping tissues regain their function, okay. And we basically tap into the body's regenerative abilities, okay. The human body has a tremendous ability to regenerate itself, to heal itself, and all the factors that we need to heal and recover are within us. Okay, so we just need to know where to look. So there's 3 different components that we use in regenerative medicine. The first is stem cells. Okay, so the pluripotent stem cells are found in the bone marrow, and they are capable of morphing into any cell line in the body. Okay, so the umbilical cord, when the fetus is in the mother's womb, the umbilical cord has a lot of these stem cells. Okay, so you may have heard of people freezing their umbilical cord cells, right? Because in future, if something happens, they can tap into their own stem cells. So this kind of builds on that, but for most of us who were born when this didn't exist, I think the stem cells can be found in our body in various places, but the places we kind of tap into very commonly is in the ischial spine, in the hip, right? And so under fluoro guidance, which is X-ray guidance, we harvest the stem cells from the bone, and we then inject it into any areas that we think needs regeneration. Okay, so this is being utilized very, very commonly in orthopedics, especially for people with arthritis. Okay, so it helps rebuild the cartilage, and for back pain too. There's been a lot of studies that have come out showing that when people have bad backs and the cartilage discs are worn out, you inject stem cell there, and you can see the improvement on MRIs.
Wow.
Okay, so there's a lot of studies being done for patients with neurodegenerative diseases. What's the role of stem cell there to regenerate the nerve cells, right? And so it's got a tremendous amount of applications, and we're just scratching the surface, if you will. And I am using it in my aesthetic dermatology practice. I use it for hair growth. Okay, so people come in with early baldness or loss of hair, thinning of hair, and so I use PRP, which is platelet-rich plasma, which is the second type of regenerative therapy, and that really helps in regrowing the hair. Okay, and another place where I use regenerative medicine in my practice, and primarily PRP, is for scar reduction. There's many teenagers who have acne problem, right? And acne can leave a lot of scars on your face, and that takes away your confidence. You become really self-conscious, right? Or you may have, or the patient may have had a burn injury, and they have had scars, okay, from whatever. Just burn is one common example. Or they may have had a bad fall when they were young or something. So for scar reduction, for making your face tight, for making your face glow, there's a lot of real-world applications using PRP. PRP stands for platelet-rich plasma, and we harvest it from just a way, when you go to the lab to get blood work done, how they draw blood, it's very similar to that. We just draw your blood and spin it in the office, and we harvest platelet-rich plasma from your blood, and we do micro needling on your face, and we inject or saturate your skin with PRP. I think the Kardashians made it very famous, calling it the vampire facial. So a lot of celebrities are getting into it. There's a lot of attention being drawn to it in social media. So we do that. The third, of course, is exosomes. Okay, and exosomes are basically like little vehicles that transport, whatever it may be, from cell to cell. Okay, so they are your little cars between two cells. So we are utilizing that to, regenerate therapy for the face and for other aspects of therapy. So that's that in a nutshell.
Wow, that's really cool. I didn't know regenerative medicine had so many real world and important applications, especially in today's world. So
Yeah, it's the
that's
way to
really
be.
interesting.
Yeah, I
Yeah.
think, in a nutshell, it is you don't have to look far for healing. You just have to tap into the body's own abilities. And I think it has a very big future.
Yeah, definitely. Yeah, yeah, me too. After like learning about what you just said, like I can definitely see like it becoming like a super big industry by itself. So
Yes,
yeah,
absolutely.
yeah. So Dr. Shri, what typical procedures do you do in regenerative medicine?
So I do musculoskeletal injections with stem cell. So I can do elbows or knees. Let's say a patient comes in with mild to moderate arthritis, right? So I inject them with stem cells, all right, and or PRP, because stem cells can be a little expensive. So if cost is a factor, then I do PRP. Okay, and the efficacy, is pretty comparable. Of course, stem cells are better, but PRP is not far behind. So I do that, and I also do PRP for hair growth, and I also do PRP for face rejuvenation.
Wow, that's really interesting. So the next thing I want to talk about is Dr. Shri. You do so many things. So do you just want to take me through like your daily routine, like what you do every day?
So my day can be very different based on where I am. I spend about 14 to 16 days in the hospital working as a hospitalist. But in the evenings, I do have my aesthetic clinic, and where I see my patients. And so my day starts very early. I'm on call starting 7 a.m. and I work weekends, weekdays, and only recently did I stop working nights because it just kind of took away my sleep and my productivity. And so my evenings are in the clinic, and I wind up about 8:39. And at that time, my calls with India start. So I'm the chief clinical officer for this nonprofit called 10-bed ICU, where we use AI to deliver telemedicine to rural government hospitals. So we are saving thousands of lives in rural government hospitals where resources are very thin, right? And so through our telemedicine platform, we are able to give them specialized care. Where previously people were dying, now we are able to give them specialized care and pull them from the jaws of death. So we are now in 225 hospitals across 9 states in India.
Wow.
And I'm at the forefront of AI as well. So my calls with India start at about 8:30 every weekday night. So Monday through Friday, I do that too.
That's actually really interesting. Thank you so much for bringing that up too. So I know we talked about this before with like the physician burnout, but are there any challenging aspects of your job that you want to highlight?
I think stress management is key. There's also monotony if you let it be. So I would urge you to, keep exploring within your own space if you want to, or cross over to different specialties in medicine, because they're all interlinked. Ultimately, you're trying to heal the patient, right? So I feel that the different specialties are like different paintbrushes, so it's up to you to kind of pick and choose which paintbrush works best for the job at hand. And I would like to, also bring up the fact that I find Ayurveda very, very interesting. Okay, it has its own role to play in healing. Okay, and I'm trying to learn Ayurveda now. Okay, so the point I'm trying to make is that within modern medicine, you have different specialties that you can tap into, and you can also learn about other branches of medicine, right? And keep learning, and don't let monotony sink in. It's very important to keep reinventing yourself.
Yeah, thank you so much for the advice. So now that we've got like the negatives out of the way, Dr. Shri, what is the most like satisfying part of your job?
I think helping people. right? There is no other job in this entire world where you can touch people's lives day in, day out, room after room, right? Every person I touch or talk to, I have an opportunity to make that patient feel better, right? My mantra is that you may not always cure, but I can always heal. All right, so that's been my guiding principle. So what is really gratifying is when I can heal them,
Yeah.
and when they say, "God bless you, doctor. Thank you. You helped me a lot." And they walk away from the hospital better than they were when they came in. I think that's gratifying. And in my aesthetic derm space, when they have regained their confidence and they say, "Well, I went out and people said how good I look," that's confidence, right? People may look at it from another frame and say, "Oh, you're just boosting their how vain they are and their vanity." But if that brings confidence to them, that's great, right? So
Yeah.
helping people.
Yeah, that's definitely like, even though like being a doctor is like takes so many years to actually become one, like when you actually like do the practice and like when you become a doctor, like I think it becomes really apparent that like you get to help so many people and like become such a direct factor in their lives.
Yes,
And I think that's like a really integral part of being a doctor.
absolutely.
Yeah.
And I'm very grateful to be a doctor.
Yeah. So if Dr. Shri, what is the biggest piece of advice you could give to someone who is aspiring to be a doctor, or someone who wants to go into like regenerative medicine, for example, or aesthetic dermatology?
My advice is, if you're looking at medicine, it's absolutely just an amazing field to be. And the future of medicine is, integration of tech into medicine. So I think a lot of excitement lies ahead, whether it's regenerative medicine or hospital medicine or bariatrics or lifestyle medicine or any surgical specialty that you want to do, or any other medical specialty that you want to do, as long as you have the passion and the goal of helping people, I think you'll find your place.
Yeah. So now going on to like a more fun-sided question. If you hadn't pursued medicine or become a doctor, what profession would you have chosen instead?
I would have been an astronaut.
Oh, wow. Can you tell me a little bit more about that?
I'm absolutely fascinated by stars and the cosmos, and it's just very humbling, and I feel many similarities between the cosmos outside, the macro universe, and the micro universe that's within us. I just feel there's a lot of similarities, and I think we are all stardust, and I'm always fascinated by intergalactic travel, and I kind of spend endless hours thinking about how life might be on another planet. I truly believe that there is extraterrestrial life. Okay, so I'm kind of, okay, how do we kind of get in touch with them? How long will it take for us to do this travel? So yes, astronomy, and that would be my second career.
Wow, that's super cool. So yeah, my last question was more like relevant to today's world, because right now so many people are talking about AI, artificial intelligence, machine learning, and that has become like super on a rise, especially today. And there are talk about like, oh, AI will take over this job, that job. And what do you have to say about like artificial intelligence taking over a doctor's job, or even assisting you in the hospital or in your clinic? If you want to talk a little bit about that.
That's a great question. AI has at least a dual role right now. It can be a co-pilot, okay, or it can be a specialist, depending on where you utilize it. Other than these two roles, I think AI has tremendous roles in diagnoses, in imaging, especially I think in radiology, it can pick up lung cancers quicker than a radiologist can. Would it replace doctors? I don't think so, but I think it definitely is a tool that would scale, the delivery of care. Okay, and I am very fortunate to be involved in this AI project in India, where I have the front row seats to actually utilizing AI in telemedicine. And so I see how we can use AI as a co-pilot, meaning if I need to think about the differential diagnoses that the patient may have with a given set of symptoms, I can then fall back on this AI tool and say, hey, what other conditions may be causing these symptoms in this patient? So in that scenario, it would act as a co-pilot, okay? But let's say there is a nurse who is manning a rural government hospital and the doctor is not around. And that nurse wants to know what to do with this seriously sick patient. And then she can input the data into the AI tool, and the AI tool will actually guide that care provider step by step on what to do, right? So this thing is evolving at an incredible pace, and I'm sure in the next 2 to 5 years, the practice of medicine will be deeply impacted by AI, and I really think it's the future.
Wow, that's super interesting.
Yeah.
And I have another question. Like, do you think AI will also like help in especially like surgery or like your aesthetic dermatology? You think it'll assist in that kind of fine skill of doing surgery?
Absolutely. I think robotic surgery is already there, right? And AI will make it more efficient, because the surgeries are kind of very mathematical, meaning there's lots of calculations that go on in the robotic surgeries and stuff. So I think AI has a role there. And also in terms of aesthetic dermatology, in terms of facial analysis, that's very important for us to deliver care. So I think there will be a lot of AI tools in facial analytics, in prescribing the right type of treatment, whether it's filler or Botox or laser. We already have AI in a laser tool that we use in our practice, and it helps in actually assessing your Fitzpatrick skin type. Okay, so the complexion of your skin is graded, okay, based on a scale called the Fitzpatrick scale. It goes from 1 to 5. 1 is your Norwegian Caucasians who are extremely white, right? And 5 and 6 is basically, the scale goes from 1 to 6, I'm sorry. So 6 is basically your African American complexion, right? So laser it's a double-edged sword. It can do a lot of benefit, but if you use it, if the energy that you use is too much for your skin type, it can actually cause a lot of damage. So you want to deliver just the right amount of energy, okay? So there is an AI tool that's built into the laser that will actually look and calculate your Fitzpatrick skin type. You may have tan, within your body you have different areas of lightness or darkness, right? So this tool will actually estimate your Fitzpatrick skin type accurately and deliver only the right amount of energy, thereby reducing the incidence of damage, from the laser.
Wow.
So exciting times.
Wow, that's really cool, actually. So that's it for today's interview, guys. Thank you so much, Dr. Shri, for
Thanks, Teja.
explaining all of these things. And I was truly it was such an eye opener for me, and I'm sure it was an eye opener for a lot of the viewers out there. So comment down below the biggest thing that you've learned today, because I have learned a lot. And be sure to like, comment, and subscribe. And that's it for today. Thank you so much, Dr. Shri.
Thanks, Teja. It was lovely talking to you, and I hope you can pursue a career in medicine if that's what interests you.
Sounds good.